We envision a movement.
We envision a movement.
We envision a movement of God's people.
A movement of God's people.
God's people who choose daily
to promote healing
in marginalized communities in the name of Jesus.
In the name of Jesus.
In the name of Jesus.
Patty and Ted, thank you so much for taking time on this Sunday afternoon to come and share with us. This is our first time to actually have a real conversation together, so I've been looking forward to this. As I've been looking at the history of CCHF and thinking about this movement and the people that are part of it, you're pretty significant because you were the very first CCHF executive director. Is that right?
I was perhaps the first one to serve as an executive director, but there were certainly another staff member before us.
Yeah. And how did you get involved with CCHF?
I'd like to tell a story, and it actually begins. I was getting my second year at Cornell University in their MBA program, studying healthcare administration. I had spent the summer of 1981 in serving as an administrative resident at Chestnut Hill Hospital. My grandmother lived in Chestnut Hill here in the Philadelphia area, and it worked out real well for me to do that. I decided to come in December and circulate my resume out to all the hospitals in Philadelphia. And I followed up.
What was your field of study?
My healthcare administration.
Okay.
So I was looking for a job in healthcare. So I spent the time calling different programs, and I soon realized the only way to get a job in Philadelphia was through administrative residency. So I ended up, one of the calls I made was to Frankfurt Hospital. Well, Frankfurt Hospital said, I asked them, did you get my resume? And they said, no, we didn't get it. Oh, do you have administrative residency? And they said, yes, we do, and would like, but we're getting ready to interview for that shortly. Please send in your resume as quickly as possible. So the next day, I ended up calling them. So I had the interview, and I was like one of 10 candidates. No sparks, but a reasonable interview. Now, after this, I end up going to the CCHF conference. At the conference, I started looking for people from Philadelphia. I said, well, here's a Dr. Carolyn Klaus. I need to go meet. So I go meet with her and tell her I'm, studying healthcare administration, looking for a job in Philadelphia. Does she know of any possibilities? Well, she gets suddenly really, really excited. And I come to know, first of all, that she was the wife of, she was the wife of the pastor of Living Word community that I was interested in getting involved with. And secondly, that she had put out this fleece, or something that God had to do in order for her to start a healthcare ministry. And little did I know I'd been set up as her fleece. So,
oh, wow.
At this point, in that conversation, it was the first of many, but Carolyn. One of 10 candidates. The interview was okay, but really, that's nice. Well, a few weeks later, like 2 weeks after I was supposed to hear about the job at Frankfurt Hospital, I get a call from her, and she says, I want you to come to Philadelphia. We're having our first meeting. And at this point, God is speaking to me, saying, can you trust me? So I ended up coming to Philadelphia. There's too much going on here. And participating in the meeting. I think Patty was probably at the meeting as well, even though I didn't know at that time. So when I got back to Cornell on bus ride, there was a letter in my mailbox offering me administrative residency for a year at Frankfurt Hospital. I looked at how much money was being offered to me, and I said, I can't afford this. It's $3,000 less than I projected.
Yeah.
can you trust me? Can you trust me?
Yeah.
At this point, I accept the offer. Well, wouldn't you know it that 2 weeks later, I got a rejection letter from Frankfurt Hospital. They had received the letter that indeed they didn't told me they hadn't. So anyway, that summer, I asked for the summer to start in September instead of June, so that I could work with Carolyn to develop a financial model that would be used later for funding for a grant with Robert Wood Johnson Foundation. So we spent that summer actually looking at various clinics in the Mantua area of town. But little did Carolyn know that she was soon to become miraculously pregnant with now David.
Yeah.
And that, God knew, was the only way to stop Carolyn Klaus. And she soon learned about, the value of health education. We ended up beginning to do health education for abundant living seminars in churches throughout Philadelphia. I think Patty began to participate in that as well. I joined Living Word Community when I went to their first retreat, and at that retreat in the May of 1982, Carolyn suggested, I'd seen Patty, and she sort of connected the two of us, so I started to pursue her and asking her out for a date. And our second date ended up being a sailing. I chartered a boat for the first time to go sailing, and she came along. But after that, she said she'd have nothing to do with me. So it was a long pursuit. But through the involvement with health education, abundant living seminars, the Hill seminars, and other things that we got involved with, we got to know each other better and what we were doing. So.
Cool.
She can tell her own story of this.
Yeah, I'm kind of eager to hear your side, Patty.
But anyway, that regarding CCHF, I just at that point from there on, I just continued to get involved with the conference because I really, the motto, living out the gospel through healthcare to the poor, just really touched me and was at the heart of what I wanted to be involved with. So. Yeah. Let Patty tell her side.
All right, Patty, you're up.
So how did I get involved with CCHF? So I am a nurse, and at that time I had left nursing and I was involved with an outreach through Living Word Community with another nurse named Jackie Philby, and someone who we were doing an outreach on behalf of the church for the Southeast Asian refugees who had flooded into Philadelphia in the early 80s, mostly Cambodians, Laotians, Vietnamese. From the fall of Southeast Asia. And so Jackie and I were both doing health education among people that needed to know about how to use the healthcare system. Women were very interested in contraception because they were coming to the U.S. with 8 or 9 children without a form of support.
Wow.
How to take care of a child with a fever, when to seek care in the emergency room. We would accompany people to primary care visits or help them figure out their way through the health system. Other people worked with clothing, with housing. And then we also had a kind of family adoption program where we would not officially sponsor families, although I did at one point, but we would hook up people from the church with families that were coming in because the social service agencies were completely overwhelmed with needs of families and would do the basics and just plunk them in a neighborhood where they knew no one, sign them up with the welfare with school and be done. So we kind of took it the next step, not financially supporting, but, just relationally and culturally trying to help people. So we knew Carolyn was going to the CCHF conference, but I think we were too immersed in what we were doing.
And this is 1982.
This is 19,
The very first CCHF conference was in Washington, in D.C. in 1982. Yeah.
So now when Carolyn came back with information from the conference and excitement and vision, she put together a task force. So of course Jackie and I were involved with that because we wanted to use our health education to help people in the city in whatever way we could. So we became involved with the task force and with the HEAL seminars and took it from there. And then Dave and Libby Caes entered our lives, but
Yeah.
that might be jumping ahead a little bit. So
No, that's okay. David, I spoke with David a few weeks ago. It's my first time to have a conversation with him too. And at one point, he described CCHF in the very early days as a community of dreamers, young dreamers that just thought, we don't have to do healthcare the way that it's been done. We can do this in a way that looks and smells like Jesus, and that's better for our patients that way.
right.
So you were one of those.
I was one of those people, yes.
Yeah, that's
I
terrific.
still am one of those people.
There you go.
Even though I'm not a young dreamer. I'm an old dreamer now. So, yeah.
We're still dreaming.
Yeah.
That's good. And so, why didn't you like this guy?
Well,
He wasn't a good sailor.
he was an all right sailor, but that's all he did was sail. He didn't relate. He didn't, talk to me.
I was just trying to keep them alive in the boat.
Yeah, it wasn't a good relational kind of trip. So I got along well with the other people. So,
Yeah.
yeah. Anyway,
But we had
I
opportunity.
changed a bit.
Yeah, I did keep pursuing. She worked in the OR, and I would come with a jar of olives and say, I love you, et cetera, all these various ways to try to woo her over time. And somehow, by the next year, I think I managed to successfully, God managed successfully to get to her heart enough to be able to say yes to my invitation to get married. But what was interesting was even at that time when we were, I mentioned we were like $3,000. I thought I was going to be $3,000 under for what was offered, but it ended up at the end of my administrative residency, a year later, I was $3,000 ahead. So that money went to help fund our honeymoon and other things. So it was, God had his plans, and he works out things if we just trust him. That's the bottom line.
Yeah, he does. So you were part of Esperanza before there was even a health clinic.
Right. So that was a process. That was probably a 7 or 8 year process. So we went from the HEAL seminars to looking at a site in Mantua, which is West Philadelphia. A lot of sites fell through before the original Esperanza site opened up. And so, we were kind of working behind the scenes, doing whatever we could to support Carolyn and Ted really in their quest. They were kind of like,
Yeah.
two brains kind of working out all the issues.
Yeah, we were, at that point, it was Koinonia Health Services. That's the name that we had for it. And it really, the HEAL seminars and other things we're doing were building relationships in the community. And it wasn't, probably Carolyn told the story of her, being asked to serve in a Medicaid mill, and all the ways that the church at that point were doing concerts, but they ended up being the most fruitful work was through the team follow-up of her patients in this Medicaid mill. And that just really set in her heart the vision of what would become Esperanza Health Center, and seeing the partnerships there, and really seeing people come to know the Lord and get involved with the church through those outreaches. Yeah. So it was powerful. So over time, as we continue that development, the Robert Wood Johnson Foundation grant and other things happened. But maybe I should go back to CCHF, because there are other parts in the early 80s that as we were, Carolyn and I both got very much involved and just really wanting to see the vision of CCHF go forward. And I know at that time they were struggling financially. There are other things that were happening, and other things that were happening that God was up to something.
Yeah.
And that's where we both. It came to a point where previous coordinator decided it was time to move on, and there was a move to move the offices. And the decision was made to move the offices to Philadelphia. And
they were in Mississippi at the time?
In Mississippi. It began in Mississippi.
New Hebron, or was it Jackson? Or
I think it was New Hebron.
New Hebron, right. So that's where, so in the summer of 1985, we ended up receiving a whole bunch of boxes. But fortunately, what had happened in 1984 was David and Libby Caes came to Philadelphia and lived quite close to us, and we came to know them, and they got involved with CCHF. So in the summer, we ended up, the three of us, four of us really, agreeing to work and to really support and further the work of CCHF as we could. So I served, I was at that time, I was Vice President of Information Technology at Our Lady of Lourdes Medical Center. I'm glad to work that out. And so I didn't need any salary or anything at this point. It was more Dave and Libby, who had just moved to Philadelphia. So they ended up taking the the salary for the one-time position and splitting among themselves. And one served as publications coordinator and the other as conference coordinator. And I just served in writing checks or doing whatever else needed to be done to help in that regard. So all that made possible, that was helpful towards reaching the goal in 1986, where the debt that had accumulated was finally paid off.
In those very early days, what was the ministry of CCHF? You said we wanted to support the work. What did that work include at that time?
One, to continue the relationships. We had multiple conferences. In 1983, I think there were two.
Really?
Yeah. One was the Church Overcoming Barriers to Healthcare. This was, I'm just looking at from March 2nd to 4th in 1983.
How about that?
That was in Philadelphia.
Yeah, and that was a CCHF.
That was a CCHF in collaboration with, at that point, a center here in Philadelphia. There were a number of people who attended. It was held at Jones Tabernacle Church, and that was in Philadelphia. And then a month later, actually, there was one in Chicago. This was a full conference in April. On Christian healthcare, serving and enabling.
Yeah. So if you don't mind, why don't you just one of y'all read the objectives of CCHF back in 1980.
All right. Some of the purposes of CCHF are to call health workers to a personal relationship with Jesus Christ, to revitalize the church's role in creating effective strategies of ministering to the poor through healthcare, to encourage, support, educate, and recruit Christians to work in healthcare among the poor, to help in the planning, development, organization, operation, and ongoing support of health ministries in poor communities, and to promote a style of healthcare that is typified by prevention, health promotion, and education, and an emphasis on personal responsibility. And then we accomplish this through publishing a quarterly newsletter, interviews and editorials, maintaining an active list of resources, members, and resource people, developing an internship program in poor and underserved areas for interested health personnel, share ideas and resources via conference, seminars, and correspondence about Christian healthcare and community development. So that was...
How many people would have come to a conference like that?
I know at one part we were maybe 150, 200.
Really?
Oh, wait.
I'm saying more like 30 to 40. I think the two in Philadelphia, there was some beginning Christian holistic kind of ministries kind of percolating in Philadelphia when CCHF came here. One was through the Diamond Street Mennonite Church, and we kind of came alongside them and learned from them and gave input to them also. So I don't remember those early conferences being that high in numbers. The
Yeah.
Chicago conference later on may have been more like 60, 80 to 100 maybe,
Yeah.
but never over 100 that I was at.
Yeah.
So.
Yeah.
It was early on, and the relationships that were developing, through this were, continued for a long time, and it continued to grow.
It's exciting to me because, you talk about these relationships that last a long time. To my knowledge, everybody that's alive is still in it. They're still involved in, at some level, they're involved in living out the gospel through healthcare among the, folks who are experiencing poverty. And, which is one of the reasons we're able to do this kind of, record these kinds of stories, because they're still, like you guys, very much involved, even if they're retirement age now, so.
Yeah, it's kind of interesting. Ted told me about this, and I thought it was focused on Esperanza. And then I realized, this was pre-Esperanza, CCHF. So I have to think back like another 8 to 10 years. But in a lot of ways, I think CCHF took us as young, idealistic people that wanted to do something already, gave us some skills, some, networking, some knowledge of people are doing this in other places. And then the Philadelphia group went on to launch Esperanza, and Dave and Libby were doing great with CCHF. So we kind of like segued right into actually doing it instead of, being inspired to do it.
Yeah.
So
the relationships with Lawndale and Dr. Art Jones and others were to set a model for us, and that was really, really helpful. They just mentored us through the whole development, and that is really thanks to the relationships that were developed through CCHF.
Yeah.
And I remember going to a number of sites and all the various conferences over a number of years that were just most encouraging. We encouraged one another. And then looking at the different models too, and no, it isn't just, Lawndale was one, but there were many others that were approaching in different ways that we learned from.
Where, do you remember some of the early works other than Lawndale? So there was clearly Lawndale, and then Voice of Calvary was happening. That's really kind of where things started, down in New Hebron, Mississippi.
Right. That was kind of the mecca that we never got there. Like we'd read about it and kind of interact with John Perkins and other people from there, but never actually went there.
And even looking at the board of directors back in 1985, Janelle Getches out of Washington, D.C., we visited her and some of the things she was doing. Jan Williams out of Denver, Colorado, we went there. Leonard Shermer in Chicago with the Circle Family Care. So all these folks were doing, involved in different places all over the country, but coming together and learning from one another. So that was just a few.
Very young John Umhow.
John Umhow, you're right.
He helped coordinate the first CCHF conference in Washington, D.C. So.
Right. So all these HPCs, he was, a wonderful mover and shaker in what he was doing. So, yes, we learned from one another in so many ways.
Yeah. I'm excited. I was with Carolyn Klaus just a few weeks ago, and we did one of these with her, and Janelle Getches, Susan Post, who was one of our early interviews here in this podcast. The day before our interview, she and I went down and visited and spent a day with Janelle, who is ill but still dreaming, still excited, still very committed to the work at Christ House. My plan is to visit Jan Williams and Bob, her husband, in Denver in a few weeks. Susie Magdapour, was part of that group too. That's very exciting to me that all of these people are still very active and all still very committed, walking out their walk with Jesus, doing it in a way that their career feels more like a calling than a career, and feels more like a mission than a job. And so you guys helped get Esperanza off the ground in its early days. And did you continue to work with Esperanza?
I actually, I became a nurse practitioner in 1985. I graduated as a pediatric nurse practitioner. So I was I was the first pediatric nurse practitioner at Esperanza. It was when we had first opened. I was very part-time because I had a little one at home.
Yeah.
And I kind of was an early staff person. And then they asked Ted to be on the board. And so I couldn't work there as a spouse and have him on the board. So we evaluated the trade-offs there and decided that it would be more important for Ted to be on the board than for me to be staff. So I had to resign my early on nurse practitioner position so that he could be on the board.
Yeah.
That's the way it was.
Did you continue to practice after?
Yes, I've been a pediatric nurse practitioner. I worked with another federally qualified health center. I've never worked at Esperanza since those early days, partially because I don't speak Spanish, and there were other things. And I'm still working. I did retire, but then I kind of got this other little job that seems to be made for me.
Yeah.
Working through the Catholic Church with a ministry to uninsured adults in South Philadelphia, most of whom are Indonesian or Spanish speaking. So I've been doing for about a year. I'm serving not as a provider, but as a clinical manager.
Yeah.
So I kind of, schedule people and, work with all these young, enthusiastic interpreters from the Indonesian community and Penn Med students and Villanova nursing students, and just kind of pull everybody together and help them all be a happy team, which they are an incredibly happy team. So
how have we not met before now?
I don't know.
Yeah, we need to be a part of. We need to be more a part of that. That's exciting that you're doing that. That's fantastic.
It's been great.
It's a very interesting population you're serving too, Indonesian and Hispanic.
Yeah.
So.
So the bottom line there is uninsured, uninsurable. Right. So they're not insurable.
Right.
So.
Yeah, anyway. Just kind of parenthetic here. If one of the rules of federally qualified health centers are that you can't be on the board if you have a relative that works for the organization. They don't want there to be a conflict of interest or whatever. So, and I know that's actually not a bad idea, honestly. I haven't been able to be on a board because my wife worked at the big FQHC, the Christian FQHC that was in Memphis. So anyway, not that they've actually asked me to be on the board, but that's a hint in case they're listening. So you've been involved with Esperanza off and on, or at some level for many years, decades now.
Right. Well, how it turned out was I continued to work on the board. Actually was president of the board for a period of time as well. But even while I was serving as president, I ended up getting laid off from Moss Rehab Hospital, where I was serving as an administrator. And God really used that year. It was a year of unemployment, but one where it was just time of growing in my relationship with him and trusting him as to what was next. Well, it turned out that when I got laid off, I had a dream as director of MIS for a North Philadelphia health system, or join a hospital down in Florida. Just my interest, whatever at that time, my interest. Well, as it turns out, after about 10 months, I got offered a job down in Florida. As I saw him, he said, well, you can have what you want, or you can have what I want. After 10 months of employment, I decided to listen to what the Lord said and turned that one down. And then later, I got offered the job at North Philadelphia Health System to serve as MIS director, but also at the same time to serve as administrator for Esperanza Health Center during a very difficult time. For half the salary that North Philadelphia Health System was offering. But that was fine. And it was so clearly the Lord was working in that time in a powerful way. I'd already written up like this 100-day contract for hope that I just really felt the Lord was going to work with and help Esperanza through a particularly difficult time. This was before they were truly a FQHC. We were a FQHC lookalike.
Right.
So we were struggling. So I ended up joining. I ended up being for 2 years to serve as administrator. Wouldn't you know it that, like, I think 2 months or less than 100 days into my beginning as administrator, New Era Philanthropy ended up that we were expecting $100,000 from that month, ended up being discovered to be a Ponzi scheme.
Oh.
And so we were, the board and came together and really, and supporters of Esperanza came together in a way that only God could do. And so my contract for hope got put aside, and his contract for hope took over. Yeah. And so from then on, I have many stories that can be told. I'll tell one story just because of the nature of the way God does things, especially in times where of need. It was a year after I joined as administrator, and Carolyn Klaus comes walking in my office on a Friday and says, "I need to resign today." Now, keep in mind, Carolyn Klaus is the one who has been raising all the funds for Esperanza and the main doctor. There was an executive director on board at the time. I was serving as administrator. And I just said, how are we going to continue at this point? But and if you read her book, it tells her story, what led to that. Well, and Prescription of Hope, for those who are interested in reading that. Well, the next Monday, I get a call from a Dr. Ramon Cadea, a Puerto Rican physician specializing in infectious diseases, who had 3 weeks before in Chicago passed had a patient die and was listening on the radio and heard about Esperanza in the song, and remembered driving by Fifth Street in Philadelphia and seeing this sign called Esperanza Health Center. And approaches pastor and said, "This is really strange. I just something quickening here." So he ended up calling me that Monday and saying, "Did you have an opening, an opportunity?" And said, "Well, we just had one opened up, and perhaps you should come and interview, for a medical director."
And Ramon eventually became the CMO, right?
Right. Well, the more to this story is later on he called me and said, "I can't come. It's too expensive. From where I'm coming, it's just not going to work out. It's going to cost $1,000 to fly from where he was and whatever." I said, "Well," at this point, I said, "God's doing something here." So I said, "Well, wait, Ramon, give me an hour to see if I can do something about this." Now, unlike me, I opened up the Yellow Pages, and there is a travel agency called To God Be the Glory Travel Agency. So I called the To God Be the Glory Travel Agency and asked them for if they can help in this, and they ended up finding a flight for $200 to Baltimore, and be able to bring him up, and that worked out. So I ended up calling Ramon and said, "Here, what To God Be the Glory Travel Agency has to work out." So as it turns out, he tells me the story later, how he's on the flight and it's coming in, there's a major thunderstorm. It's going into Baltimore and they're about ready to turn around. And he's saying, oh, God, thank you. He's saying. But it turns out the weather changed and he comes in and he has the interview. Now, at this point, he comes to the point where he accepts the offer and says, I can begin in September. Now, this was like in May. I says, God, how are we going to survive till September? He says, can you trust me? And it's just all the more things over and over again. And at this point, there's too much going on in the story to say, yes, God, we're going to be around in September because you've called Ramon Gadea to come and join us. And that led to a whole grant from for HIV and other things that wouldn't be possible or without him calling the right people at the right time. Yeah. And he does that. And eventually, a year later, it became clear through other things were going on, we were still struggling, it became clear that it was time for me also to move on to make room for new leadership. So I ended up serving, the board decided it was time for change in staff, and I ended up serving almost on a consultant basis for 6 months because I had done all the financial parts with the state and all the reports, and they brought in a consultant to help bring understanding to all that and help us through that difficult time. So I ended up at the right time. Lord opened up a job for me at Temple University Health System, where I was served as executive assistant to the CIO and served in multiple roles there over a period of 25 years, but kept involved with Esperanza, just keeping in touch and with people just over time, with Susan and others that were just, God has his way of bringing the right people at the right time. Yeah. So,
and you were also a patient at Esperanza.
Yeah, I was a patient there. Dr. Brian Hollinger was my physician and a marvelous friend too. So we ended up I was able to continue to encourage. Now, from there, I ended up seeing the value of networking, started to network with the body of Christ overall in the city and also elsewhere. Ended up bringing together leaders from North Philadelphia community and into a conference room at Temple and Health System and asking them what would most improve the health of the community on population health perspective. And the answer they came back was that there are thousands of organizations that are serving this community, but they can't talk to each other. There are no relationships and very little collaboration. Right. So that's the work that began 5 years ago. We've been meeting, building relationships in the community. It's now called Community Connections Collaborative. And the Lord keeps bringing to me people that He asks me to connect with other people. They're doing like things, and we're starting to really do some see fruit from that in a way that only God can do. And that's I just sit and marvel at His ability to bring people together, connect them, and allow His work to be done. So that's what I'm up to now after retirement. I actually facilitate 3 different groups of people that God's brought together. Many are believers, some are not, that all are caring people who want to improve the community health. Yeah.
That's really interesting to me because I think the next step with CCHF, honestly, our focus has been so much for the past decade and a half, maybe 2 decades, on clinics, Christian clinics like Esperanza, and so many of them. There's 350 Christian clinics that we know of that are trying to deliver distinctively Christian health care, which means 350 different things to 350 different, groups. Probably half of those are really involved in CCHF. But one of the things that we're becoming aware of is that while 350 sounds like a lot, there's, until they redefined what a medically underserved area was, there was over 17,000 medically underserved areas in the United States just, 2 administrations ago. And And it's not like they disappeared. They just got redefined so that there's now, a few thousand medically underserved areas where they're just massive. All that to say, there's just so much need in the United States. I mean, so much need. Over 2/3 of people who live under poverty are not being cared for by any safety net clinic or healthcare organization or anything. And we really think that what you're doing is the future of CCHF in the sense that we're a Christian organization, but identifying these Christians in secular organizations that are in strategic positions of influence that can help bring really a demonstration of the gospel into those places. I think that is, and these are people working in a secular setting for various reasons. Maybe they're called to be salt and light in those kind of places. Maybe there's just not a Christian place for them to work, and that's okay. We want to be supportive of them, and there's really not a lot of support for the work that they're doing. There's Christian support, hopefully, from their churches and other organizations, but for the actual work to, let them shape the vision of this community. So I think that that's the future.
Yep.
So
I know Patty worked for how many years at a secular health center, a nurse practitioner run in North Philadelphia. And she learned so much of that. I've learned a lot through her and her stories. And just an example she was setting in that place. A very difficult place at times.
Yeah.
But at the same point in time, you're right. That's where we can be light in dark places, and people can see the difference that Jesus makes in us.
yeah, that's right.
I do want to share relationships matter. And that's actually the motto of this community connection collaborative group. But the relationships come through, even for young people, through the experience of going to, other clinics and seeing other people doing the work in a way that's making a difference. And I think it's up to us both as providers or people, professionals, whatever, to be reaching out to others to give them that opportunity and to open up the channels. COVID really has made it difficult for, I think, many young people to do or learn how to network and find those opportunities. So whatever we can do to help bring about those opportunities to help them to connect. I think the more likely we'll see some positive changes and positive things go on in the future. So I appreciate what CCHF is doing amongst the students and the challenges of that. Now, but coming out of COVID, I'm seeing a lot more people open up to networking opportunities and coming together and starting to be honest with one another. That's part of it. And to be humble enough, because that's part of verse 8. One verse that has really been, I've been meditating on for a while is Philippians chapter 2, verse 3 and 4. It says, "Do nothing out of selfish ambition or vain conceit, but in humility value others higher than yourselves, not looking to your own interest, but each of you to the interest of others." And if we can get to that place in the body of Christ where we are looking out and looking and listening and to others in a way, including those who are going to follow us, I think may begin a dialogue that will be helpful, similar to the dialogue we've been having here.
Yeah, that's great.
So,
Patty, anything you want to add?
I'm going to say I think I'm very happy to hear that you're reaching out to students and to the younger segment, even of the student population. because as you age, you get to a point in your career when you realize that inputting into the younger people is going to give you more bang for your buck than you know, it's like if we don't share our vision and our hopes and dreams with our younger segment, it won't continue. So part of my role at the Unity Clinic is to really input into younger people that are going to change the course of medicine. They're going to define what medicine is, and, you know, to channel their youth and enthusiasm and idealism in the right way so that they maintain it and so that the system doesn't, you know, kind of diminish that. So, yeah, I'm very glad to hear that you're reaching younger and younger student populations too. So,
Yeah, I think it's one of the things that makes CCHF a fun place to hang out. You know,
Yeah.
a fun. We love the conference because we have so many students that come to the conference, and they're hungry and they're serving. And you know, whenever we get a chance to talk to them, we always tell them, you know, there are heroes in the faith who've got 30 or 40 years of serving Christ in really effective ways that are here, and they'll have lunch with you. You know, they'll sit down and let you ask them, how did you raise your kids in the neighborhood that, you know, my parents told us we should never go into? Or what do you do about, you know, what are some of the challenges and what have been some of the difficult things? And I think the stories and, you know, following in the shadow of some of these heroes, I think is really great. Talking about relationship, one of the things that I've learned over the years is how many couples there are today because of CCHF conferences, and I think y'all might be.
That's true.
You
might be
put us in that list.
the first couple that got married, that ended up marrying because of somebody they met at a CCHF conference. But I'm so glad that you guys took time. I'm eager to see all this. I'm gonna have fun kind of wading through some of this stuff that you're gonna let me see. I appreciate your perspectives on the early days, and very grateful for just y'all's continued faithfulness to follow Christ and to serve the poor in His name. And
I must say, God doesn't call just one person. The teamwork between
right.
David,
Yeah.
Libby, Patty, and me were essential.
Yeah, that
I
was
mean,
that was a sweet, sweet time. We
Right.
were all for it in it, all gung ho.
Right. And,
With
and
all of
that
our
made
energies,
the difference.
yeah.
I'm just seeing all the more. God doesn't call one person to do something alone. He'll bring people around that share the vision. And ultimately, that is what gives Him the glory.
yeah,
And because He's the one who brings it about, of what His plans are. And I'm enjoying, you know, just watching Him continue that work, and in CCHF and other places that He is working so powerfully.
yeah. Well, thank you guys.
Sure.
Thank you.
Thank you.